responsibility. That's what I want to zoom in on today. Because responsibility is, a friend of mine calls it extreme ownership. Okay? Just owning whatever your situation is. Own it. Take responsibility for it. Don't have excuses for it. What's an excuse? An excuse is any reason I give for not getting something done.
Lack of accountability.
Lack of accountability. So any reason I give for not getting something done is an excuse. It's a reason if I get it done.
Right.
That's why I couldn't get it done, and I got it done. It was a reason for not getting it done until I got it done. But until you get it done, it's an excuse. Don't be accepting of excuses in your life. Don't be accepting of reasons why you can't get things done. Let's give it some balance. I'm not trivializing or minimizing things that happen to people that they have no control over. Not at all. You think you had an accident, you got raped, whatever it is. Things that happen to you that you had no control over at that point in time, they happen to you. Having said that, the chances of those things happening to you again are higher if you don't take responsibility.
Gotcha.
If you don't own the fact that you were in this situation. Yes, you were raped. That's horrible. One of the worst that can happen to any human being.
Right.
What role did you play in that? How did you put yourself in that position? It may not be of anything that you did. So before anyone shouts me down,
Right.
I'm not blaming you for being raped. I am saying look for a reason that you can change so that the likelihood of it happening again is less. Because it's there. So that you won't find it unless you have that mindset. Okay, there has to be something in this thing I could have done differently.
Right.
And had a different outcome. Whether it's rape, whether it's being broke, whatever it is. Whatever it is, there's something you can do differently. Because I'm someone that will fall. And when I fall, that means fail. Right. When I say fall, I'm talking about failure. I fail at a business, I fail at whatever it is I'm trying to achieve. When I fail, I fall down. Yes? Figuratively. On my knees on the ground, there are pearls on that ground that I have to pick up. Because if I don't pick them up now, I'm going to fall again.
Right.
To pick up those same pearls. So any failure, any outcome that you have that you don't want, learn from it.
So what do you say? What do you say to the patient that's not having a problem being responsible for it, but just having a problem adjusting to just the switch of life? Like because they was living a perfectly normal life and then bam, all of a sudden they have kidney failure, bam, they're on dialysis. What do you say to that patient? Because I don't want to say they're not being responsible, but in that transitional part, what do you say to that patient that needs to just adjust to now you're a dialysis patient?
Okay. So again, this may sound militant,
Right.
but if you're having a problem adjusting and affecting your quality of life, it's affecting how you feel because you're having a problem adjusting. Get adjusted.
Okay.
Get adjusted. If that's the only thing stopping you from feeling better on dialysis and having the good benefits of dialysis, then change the narrative. What are you telling yourself? That why am I on dialysis? It shouldn't have been me. Why me? I did that. When I got prostate cancer, I did that for a few months.
Right.
Why me? Well, after all I do, why me? I'm a healthy guy.
Right.
I do healthy things. Eventually, when I started being able to reach out to people that had it and communicate with them, I'm like, why not me? But when I reached out to enough people, and I was able to impact enough people, I'm like, thank God me. I don't thank God for having cancer.
Right.
I thank God for what I've learned through the ordeal of having cancer. Now, if it took having cancer to learn what I've learned, would I want to have cancer again? I want to learn what I've learned a different way. But
I think everybody would.
it is what it is. I have it. I had it. I'm treating it. I'm learning a ton through it. I'm able to impact so many people that have it. I meet them every day. I was treating them already.
Right.
Now I'm one of them. So at the end of the day, you're on dialysis. You are walking with a pair of shoes through life before. Overnight, sometimes. They call it crashing into dialysis. Yeah? You crashed into dialysis. When you get into dialysis when you had no problem before.
Right.
As opposed to majority of my patients today, they don't have end-stage kidney failure, but they have some kidney disease. They're on their way to having end-stage kidney failure, unless they change their ways. So they don't crash into dialysis. If it continues to deteriorate to the point where they need dialysis, then they'll go on dialysis. But they didn't crash into it. They are ready for it.
Gotcha.
It's proactive, as opposed to reactive, where you crash into it. But here's the thing: if you're crashing to dialysis, yes, that means today you are fine, tomorrow you're on dialysis. You crash into it. You have to start wearing a different pair of shoes to continue walking through life. But continue walking through life. Now that mindset, like you just described, sometimes it's harder than for some than others to adjust, like you said, that transitional stage where you're trying to accept dialysis. What I'll say is, like most things in life, when the negatives happen, the sooner you adjust to it, the sooner you grieve the loss. Loss of freedom, loss of health, loss of a loved one, loss of whatever it is that you have lost. Grieve it as quickly as possible. Yes? I say this with all the love in the world, guys. Grieve it as quickly as possible so you can get on to living. Because as long as you are alive and there's breath in you, you have a reason to be grateful. And again, when I say these things, I'm not trivializing those that are having a rough time with dialysis, having a rough time with cancer, having a rough time with whatever. No. I am trying to I am trying to get you to change your focus.
So, all right, so like Kel said, it's not just adjusting the dialysis. What about people that had a successful life? Like she said she was making almost $6,000 a month. Now she's down on Social Security making $2,200 a month. Financially, it's an adjustment that a lot of people wasn't prepared for, because in reality, like, dialysis it leads to poverty if you don't have the right finances in order, if you don't have the right partner, if you don't have the right support system. If you get on dialysis and it's just you, poverty is not too far away.
That's a good point. That's a good point. And it's interesting because at the end of the day, if your kidneys failed 150 years ago, you'll be dead within a few months. So we'll be having this discussion at all.
Understood.
But because of dialysis now, because of technology,
right,
we now have a way to perform a function the kidneys perform.
Gotcha.
Right? So now we are discussing on the other side of what was killing people. We're discussing about the other side of it now. We've gotten past kidney failure. You're not being treated. But because of the limitations you have, either because of the treatment itself, because that takes away time, it takes away that commitment to be able to be at work on time, and it gets you tired that day sometimes. You have limitations.
Right.
You now have to become creative within those limitations. I don't have a clear answer for that person.
Right.
What I will say though is, please be creative.
That's it right there.
Get creative. Listen. You're being given a new lease on life. Yes, it's different, but would you rather be dead?
That's it right there. We have to find. It's just like you got fired from that job where you was making six figures. You would find another way. And on dialysis, we have to be kings and queens of finding another way. Because I was making six figures at 18, 19, selling timeshare when I found out I had kidney failure. I've never worked for corporate America again since I became on dialysis. So, I mean, we have to find another way. And that is just that. It's just that.
It really boils down to that.
Yeah.
And it may sound militant, coming from down like you said it.
Yeah.
It may sound militant. It may sound like we don't care. No, we care. But we know that you have to pick yourself up by your bootstraps. You have to pick up and go. You have to get creative and vulnerable. Get vulnerable.
I'm still working on that.
And it's hard, especially for us men. It's hard.
Yeah, I'm still working on that.
Putting ourselves out there that we need help is challenging.
Yeah.
But guess what? If you don't, you won't be seen by the person that can help you.
Yeah, indeed.
It's that simple.
Indeed.
So yes, you have to wear a different pair of shoes, continue walking through life, but please walk through life with those different pair of shoes. Get creative. Get out of your comfort zone. Get creative. You were making $6,000 before, now you're making $2,200 through Social Security. Get creative to generate more revenue. Look at Daryl. Get creative, generate more revenue because you can. It may involve talking to people that you don't talk to normally. Get ideas. There are other people on dialysis. Some of them are doing well. Speak to them.
Yeah, I tell a lot of dialysis patients, as dialysis patients, we have to get away from the physical work and learn how to make money suitable for us. You have to learn how to get on this web, learn how to open up websites, start a Shopify, things that you can do that don't take physical work. Because the physical work, we have to accept that we're on dialysis. Regardless if we do it or not, we do have to accept that we're on dialysis. Like Queen says, she used to be able to work 2 to 3 jobs at a time. As a dialysis patient, you could work 2 to 3 jobs at a time. It's just what 2 to 3 jobs you're working. You can have a Shopify. You can have a clothing brand. You can have a food truck. There's so many different things you can do, but you have to take away the physical aspect of it. You cannot, as a dialysis patient, work 2 to 3 jobs a week. You just, physically, you can't. You can do it. It just can't be 2 to 3 jobs physically. It can't be somewhere you have to physically be, nothing like that. But it's definitely possible.
And the truth is, in today's world, as opposed to 30 years ago, this is digital. Everything is virtual. Right?
Indeed.
So you have to get creative, find the need, and supply it. You have to get techie. I have lots of people over the age of 50 talk about how, technology is keeping away from me.
Can't do that.
You can't.
Not in 2026.
You get left behind.
You cannot.
You cannot not know the tech and be left behind by it.
Yeah.
You can't. Otherwise, you will be left behind. You have to learn it. And there's so many people to teach it. Online, you learn it. It's responsibility.
TikTok will show you everything. TikTok will show you everything you can possibly think of. And I personally offer dialysis patients to be their drop shipment companies. I have about 6 dialysis patients where I make their merchandise. I make their hoodies, their sweaters, their pants, their hats. This one lady just reached out to me yesterday. She's starting to make hats for her daughter's soccer team. She made 10 hats, and now she's making hats for the whole, I don't even know what to call them, all the teams. She's making hats for all the teams now.
That's awesome.
You know what I mean? And she's a dialysis patient. All she did was reach out to me, send me the design. I sent her a couple samples. Now she's making hats for all the teams. So we just got to figure out ways that's suitable for us to make it work.
We really do.
We have to.
It has to be done that way. And he just described something that people should be jumping on. Connect with him. See what you can do in that space.
Yeah.
Because there's money to be made. There is money to be made.
Everybody's selling something these days.
Absolutely.
Everybody is selling something these
because
days.
back in the day, it was harder to sell things.
Right.
You had to either have a shop or have a warehouse. It was harder. Now,
you don't even have to have them.
Now
All you have to do is just have your design.
It's amazing.
Send it to me. I'll make it. Send it back to you. And now you can create a website. You can sell it at your kids' games. You can have your kids. I have another lady where her son, she makes clothes for her son, and her son wears the clothes to school, and he sells what he wears. Wow. You know what I mean? So it's just so many different ways to make it. You don't have to physically be somewhere to make money no more. It's 2026, and as dialysis patients, we have to come up with the times. We have to.
You know the funny thing? This actually goes for patients even more if you're not on dialysis. You have no excuse. If you're on dialysis, you have the excuse of being on dialysis. I still call that an excuse because you don't have the outcome you want. Right. The outcome you want is wealth. The outcome you want is to be financially viable, financially, fluid. You're not getting that outcome if you sit on the fact that you're on dialysis or some other reason why you can't be physically at work. Everything can be virtual now. Find that need. Find that niche for yourself. And the easiest way to find it is by talking to people. People that are doing well, as far as you're concerned, talk to them. What are they doing that you're not? What can you learn that they're doing?
Kidney dialysis diabetic said, I need something to cover my catheter exit for the shower. So basically something to cover the catheter site for a shower. Are they allowed to take showers with the catheter site?
So I think what you do need is to get a fistula or graft in your arm and get that catheter out. That's what you need. Now, in the short term though, no, you should not shower. Because even if you cover it, it's not foolproof. And water is the easiest way to get that catheter infected. And remember that the tip of that catheter sticking out of you, its tip is sitting in your heart. So the catheter serves as a bridge from the outside into your heart for bugs. An infection of catheters is the most painful way I lose a patient. And I've lost a few that way. So I'm very emphatic about it. Get it out. Get a fistula or graft in, please. Yes, it's less convenient. Yes, you have to get stuck. I get that. But it's life-saving. Catheters lead to a chronic state of inflammation. Because something is against your blood all the time that should not be there.
So what do you say to the dialysis patients on TikTok that have had catheters in their chest for years that say they would never get a fistula, and they encourage people not to get a fistula because they've had a successful time with a catheter?
Okay. So I would say not everyone that smokes gets cancer. So that's really true. Not everyone that smokes gets cancer. So you may get away with having that catheter in for, I had a patient that had it for 5 years before she died. Wow. She died of an overwhelming infection. It spread to her spine. You can get away with it for a time. But why risk that if there's a foolproof way of preventing that? Being on dialysis affects your immune system, not being on dialysis. Having end-stage kidney failure affects your immune system. That means your immune system is needed to get rid of bugs, yes? To clear infection. When you get infected with a bacteria, a virus, a parasite, your immune system clears it. Your immune system is also important for cancers. Abnormal cells, the immune system clears that as well, right? So if your immune system is depressed because your kidneys have failed, then you don't take care of the infection the way you should. So you definitely need antibiotics quickly for an infection. Why go through all that with that catheter? Catheters are supposed to be short-term. You're supposed to use a catheter until you have a fistula under your skin. You want the skin barrier to work for you. The skin is there to protect you from infection. The skin is there to keep heat in. The skin is a powerful barrier for things you don't want. Now you're going to have a break in the skin that leads directly to the heart for months, years on end? No.
Get it out.
Get it out. Please.
Those of you that's scared to stick yourselves, don't. You heard it from Doc himself. Because a lot of y'all have been in my DMs asking me about the same thing he asked for, something to take a shower, something to cover it. I didn't want to answer nobody because I'm not a doctor, so I wasn't going to say or tell you where you can go and get nothing. I wanted to talk to him specifically about this. So for those of you that have been asking me, let's not worry about covering it during a shower. Let's worry about getting it out and getting the fistula.
Straight up. While you have it in, don't shower. Sponge bath. Don't shower. Get it out or sponge bath.
And if you don't want to get a fistula, PD is also an option. You don't have to go to hemodialysis. If you're so worried about sticking yourself, if you're so scared, go to PD. Go to PD. If I wasn't such a shark and loved the water so much, that's the only reason why I can't do PD. Because I'm going to get in water.
With what I know, even though I like water like you do, I will do PD. Because PD gives you a time where you can save your accesses for fistulas. The veins can get exhausted. They can be... I have a patient right now who has to go on PD because there's nowhere else to put a catheter or create a fistula or graft.
Wow.
She's exhausted every day. Here. She had one here. She had one here. The back.
In the back?
Yes.
You could put a fistula in the back?
Yes. One more. She had
Some
one.
paper towel for that?
She had one here. What is it?
I had the doors open.
Okay. She had one here and one here. So everywhere was exhausted.
Wow.
So it becomes very, very. She had one in the chest, not the catheter, but they use a heart and a vein. So it becomes very, very important to become totally intentional. Thank you. Totally intentional in getting in doing PD to begin with, before you start hemodialysis, and it's actually better. It's a better way to transition. Using the word you used earlier, to transition from normal life to dialysis, PD is better because hemodialysis is a bit of a shock to the system.
I agree. Like me personally, I do dialysis pretty much like PD. I try to do dialysis as often as possible because I realize that doing it more helps. But that is a transition, and it takes doing bad in order to appreciate doing good.
Oh,
I say it all the time. A lot of dialysis patients complain
let's repeat that.
because they've never felt the bad of dialysis in order to see how much dialysis brings back good.
Repeat that one-liner. It takes...
It takes feeling bad to appreciate feeling good.
It takes feeling bad to appreciate feeling good.
Definitely.
Which is why I had to change the way I practiced. The way I used to practice, you get down to 10%, I put you on dialysis.
Right.
But then, you didn't feel bad. So dialysis didn't make them feel good, so they hated dialysis.
Agreed.
So they now feel bad, they have symptoms, I now put them on dialysis, and they feel good. It takes feeling bad to appreciate feeling good.
Right.
Well
So
said.
would you say a main, because Suzette just said the main component to managing CKD is diet.
Yes,
Okay.
yes. To managing pre-dialysis.
Right.
So pre-dialysis, to avoid getting on dialysis, diet is important, not diet, lifestyle. Lifestyle is important for kidney failure, heart disease, strokes, but guess what? Lifestyle is important for the big three. The big three. What's the big three? High blood pressure, high blood sugar, high blood cholesterol.
Right.
The big three. Lifestyle reverses all those three problems totally. Without medication. It reverses them totally. But those three problems lead to the leading causes of death in the world. Heart disease, cancer, stroke come from high blood pressure, diabetes, high cholesterol.
Gotcha. Gotcha.
So lifestyle is key. I won't say diet. Diet is part of lifestyle. A plant-based lifestyle is king.
Gotcha. Okay, well, Suzette is actually a dialysis tech, so that makes sense.
Ah.
That makes sense. That makes sense. Don't let anyone tell you don't let anybody tell you what you want because you're going to dialysis and it will be pulled. Gotcha. So don't let anybody tell you to eat what you want because you're going to be on dialysis and it can be pulled.
Oh no!
Listen. Let me tell you what she just said. What she just said is so oftenly said to dialysis patients. I can't make that up.
Not by medical personnel. By
matter of fact, yes, some have. I promise you, some have actually told me that you're on dialysis. Don't worry about what you eat and drink. It's coming off on the machine.
Hey.
Yeah.
So
That is definitely something that's told to dialysis.
Let's debunk that very quickly. Dialysis does not remove the crap you ate. No. It does not remove the crap you ate. It can remove some of the poisons that have resulted from the crap you ate. Sure. Like the kidney does. But the crap you ate, what I'm worried about is things that clog up your arteries. Where blood flows through arteries and veins. But it flows through arteries to get to organs. That's blood that has oxygen in it. You need oxygen to burn the food you eat to make energy and heat. Now, those arteries, those pipes that blood flows through, when they get clogged up, whatever blood doesn't flow through, whatever blood doesn't flow to, dies. So if those pipes get clogged up and they're leading to your heart, you get a heart attack. If those pipes clog up and they lead to your brain, you get a stroke. If those pipes clog up and they lead to your kidneys, you get kidney failure. Whatever part of the body the pipes get clogged up and they're supposed to be supplying blood to, doesn't work like it should. So it becomes very important to eat in such a way that you don't clog up your arteries. In fact, you want to eat against clogged arteries. You want to eat in such a way that you get your arteries unclogged. And you can. You can get stuff that clogs the arteries to decrease. You can starve them. You feed them with meat. You starve them with plants. That's simplifying it to the most simple way I can put it. You starve the clogged arteries with plants. You feed the clogged arteries with animals.
Gotcha. And how often would you say you should eat animals a week?
Once.
Once a week.
Well, that one day a week that you have your animal, eat the whole cow. Eat as much as you want.
That one day.
That one day.
And the other 6 days.
The other 6 days, heal the body or let the body heal itself. So here's the thing. That one day, you take a small piece of meat, you take a whole cow, it's the same inflammation you're going to get. Inflammation starts as a whole process.
Gotcha.
It starts once it's exposed to fat, sugar and things as well. Once it starts, it doesn't stop until it stops. Small piece of meat or the whole cow. So what you want to do is expose yourself to your animals for the day, and then let your body do what the body does best.
Gotcha.
Heal itself over the next 6 days. But not just heal itself and develop capacity to withstand the onslaught of the animals about to come on the 7th day. Because as much as I enjoy it, please don't get me mixed up here. I am not vegetarian at all. I love my steak, my
I'm happy you clarified that, because I'm sure they was
I
like,
had to.
Gotcha.
I get that all the time.
Right.
You're vegetarian? No, I'm not vegetarian. I love my meat. As much as I love my meat, I love this guy much more.
As you should.
Period. And that's the only narrative I can use to stay on track.
Right.
Or to get back on track. Because I mess up sometimes. Especially when I travel. I love to travel. So when I'm traveling, I'm about to travel very soon. When I travel, I know for a few days my eyes will be shiny, looking at everything I don't have around me at home. Because I'm out, I'm enjoying myself, I'm having a holiday. But I'm in the process of getting to my holiday at the end of the weekend. I am doing things right to build capacity to withstand that holiday.
Got you. So you're withholding.
Totally. So I can enjoy that holiday.
Makes sense.
We have to do this. Indulge with wisdom. Indulge, but with wisdom.
Eat with intent.
Yes. Eat to live.
Got you.
Stop living to eat. Most people live to eat. Eat intentionally, purposefully to live. Live a better life. Live a more abundant life. Yes. Make your food your medicine. Make your medicine your food. Because you can. It's a choice.
Okay.
It's a choice.
Well said, Doc. Well said. Well said. You just made me think a little bit.
I saw the light bulb light up on your head just now. Like, he got that right.
Yeah. You just made me think a little bit. Okay.
Very, very important.
All right.
I can't stress it enough. And when people get that, I believe, and this goes back to something you asked me before, how can I continue to encourage people to do the right thing when they're doing the wrong thing repeatedly?
Right.
And it boils down to me, I said it to someone just a few minutes before I came here, where what you're doing as the wrong thing, and you're doing as harming you, and you're doing it because you don't know better. If you know what I know, you won't do it. Now, if I tell you what I know, and you still do it, you don't know what I know yet. Because I have extreme ownership, I will figure out a way to make you know what I know. So I'm going to have to tell it to you 10 different ways to get through to you. But I will know I've gotten through to you when you're doing the way I do. Because now you know what I know.
Gotcha. If you know better, you do better, right?
You know better, you do better.
You know better, you do better.
So for the teachers, if they're not doing better, they don't know better yet. Teach them some more. Don't give up on them. Don't give up on them. Some people are hard-headed, especially us men. Don't give up on us. Find another way to say that same thing, to get that same message across. Sometimes you're not receiving because of the way it's said, or environment, or whatever reason. But just recognize that he's still doing the nonsense he was doing before. There's only one reason for that. He doesn't know what you know.
Gotcha. Makes sense. Makes sense. Well, there it is, y'all. There it is. Y'all remember every Thursday we will be live. Me and Dr. Awosika, we will be live. We're basically just trying to create a platform for dialysis patients. A lot of us just do wrong because we don't know how to do right. You know what I mean? So we're here. If you have any questions for me as a patient, or if you have any questions for Dr. Awosika as a physician, we are here every Thursday at 4:30 live. Remember, we also have dialysislifestyle.shop where you can go and get access coverage for wherever your access is. If you have access to your arm, leg, catheter, PD, anything like that, and you don't feel like taking your hoodie off or your clothes off when you do dialysis, go to dialysislifestyle.shop, and we have merchandise to where you can do dialysis comfortably and not have to remove your garments, all right? Any last?
Well, for my Instagram followers, I've been kind of toying with using this platform to communicate with you guys. This platform really is geared towards dialysis patients, but we like to talk about other topics that will empower people to thrive, other topics that will empower wellness in people that are not on dialysis. So I think I'm going to continue using this one, but it's geared towards everyone. For patients on dialysis, this is the only platform I've seen so far, and correct me if I'm wrong, Darryl, where we create a platform where we can support them. Definitely. We can answer questions. I don't know if anything is out there.
We're the only dialysis platform that has a dialysis patient and a nephrologist on the regular to answer questions, to provide guidance, to encourage you to do better, encourage you to thrive while you're still on dialysis. Yes, we're dealing with something, but we're not dealing with something that's stopping us from thriving. All right? So if you need us, we're here. Every Thursday, 4:30, Dialysis Lifestyle. This is what we do, all right? So we appreciate y'all tuning in. Till next time, love as always, and I'm out of here.
Fantastic. Thank you, everybody.